Hi.
Wanted to make sure everyone's doing well from the coronavirus, and we're getting ready to get off of our isolation at home, even though they don't think we should leave home.
I know these are trying times, and we were trying to do something to make you more comfortable and ourselves more comfortable too, because dentistry is an aerosol generating profession, and the virus lives in aerosols. So far, the CDC and the ADA have been making recommendations to keep us safe, but not really recommendations to kill the virus, which is all about. So we have installed some techniques that will kill the virus.
And the big problem is that we don't know if people are carrying it. You could be asymptomatic and you could bring it in the office, have work done in one room, and be infecting people in another room. So we want to make sure that people are safe, and we're trying to go above and beyond what the American Dental Association is recommending and the CDC by including these different techniques and technologies. One of the first things that we think is very important is that we want to be able to control aerosols that are spraying from your face when someone is working, say spraying water or drilling or having a cleaning done. So what we have ordered and coming in hopefully very soon is they're called extraoral suction devices, and they are basically kind of like a shop vac, medical grade.
For the mouth.
For the mouth. And they would sit next to your face while you're being worked on, and any aerosols being generated from drills or spraying, breathing, they're going to be sucked into this extraoral suction device, and they will be brought in, and then they will go through a series of filters and UV filters and clean before they're expelled in the rest of the office.
And that will remove any virus or bacteria so it doesn't enter the room or the room next door or the atmosphere.
Right, and so not only are we, keeping staff safe, we want to keep the patients safe. Another item that we're bringing in that they're not really talking about a lot, or you see it, and they're called UV sterilizations. And we're not talking about those little wands that you use that you could maybe sterilize your phone or something like that.
Or your dog.
Or your dog. But they're the type of these large units that they use in hospital operating rooms. And we'll roll them in after each patient, seal the room off, and then after about when the UV sterilization comes out, then it'll allow us to kill all the pathogens in the room that might be floating around from the previous patients that we don't know could be contagious, and it will kill all those pathogens, so when you come in the room, that the space is sterile and perfectly safe for you.
So we're doing two things that are above and beyond all the CDC and ADA recommendations you've already heard about. We have the high-speed suction that will remove any aerosols from the breath as we're working so they don't enter the air. And then further, we're sterilizing the air after every patient to make sure anything that we could have possibly missed will be killed.
Right. And of course there's a number of other things that are being recommended. You'll see portable HEPA cleaners all around the office circulating, cleaning the air. Obviously we want you to wear a mask when you come in, keep your social distance, and we'll be sending out another video talking about procedures for when we come in. But what's most important is that we didn't want to get started seeing people unless, besides the staff being safe, we need to make sure patients feel safe. And we think with these technologies you will feel safe also.
We also think there will be a paradigm shift in dentistry where these types of things will be required in the next few years. So I really think we're just going to be ahead of the game.
Right, so share this video, because I doubt that 99% of other dentists are doing these sort of things to keep their patients safe, and we'd love to have them as patients also. So we want you guys to be safe, and hopefully after next week or so we will see you soon.
See you in the office.
Thank you.
Bye.
Bye.
Here's your cookie. Such a good cookie.